Secondly, the palliative care ministry, which some people combine the two, the clinic and stuff. And actually the Rafael clinic was something that had been in Carla's heart since she was very, very young, but the Lord unpacked and kind of made a vision for that throughout. And actually when we moved to Africa, we didn't really want to build anything physically, or like, it was a lot of stress, and we felt like our ministry had already done what God wanted it to do in the sense of like thriving. And so the Rafael clinic, like she said, is a way that God has fulfilled something in her to do something sustainable on the land where we can partner with the community and the government to actually help themselves. Whereas the palliative care ministry is a little bit different. This is what has actually brought us into Mozambique in the first place, was Carla's medical side opened the door for us as a family to come and serve Mozambique. Before we left for Africa, a good 10 or 15 years before, Carla had spent many of her years honing the ability to work in that industry of palliative care. And so it became a passion in her heart, and it became something that she realized the Lord is preparing for in Mozambique. What is the community need and the understanding of what palliative care even is? Because we were out last night with our friend Zay, and we realized even workers, healthcare workers here, don't even have a clue really what palliative care is.
Yes.
How many people does Carla see a week right here on our porch and right in that little gazebo area back there on a daily, weekly basis? And then also, how does the ministry look right now between her and her colleague, and how does she want it to look? Because though it'll partner with Rafael Clinic, whether Rafael Clinic was there or not, this would continue to go.
So palliative care, it's even a newer thing in the Western world, but palliative care really is a holistic approach to caring for those with chronic disease, serious disease. We say terminal disease, a disease that will end their life. That could be, people are used to hearing hospice care and they think that's palliative care. Hospice is like the last 6 months, or you have 6 months or less to live. Palliative care is, say, you get a diagnosis of cancer or here HIV, immediately palliative care should kick in. You should have a holistic approach of being cared for spiritually, emotionally, medically, medications.
So you've had people on your palliative care program that actually haven't entered into hospice?
Correct. I've had to sign them off my program.
Yeah.
So,
that's amazing.
And people here in Africa think palliative care is HIV and tuberculosis.
That's what I was going to ask you.
But what we're seeing in Africa and what we're seeing in our area is actually cancer is on the rise. Diabetes, heart disease, lung disease.
Way higher than TB.
It's actually becoming,
HIV,
it's surpassing HIV
I would agree.
and TB, and that's sadly where all the funding goes. But what we're seeing again, that the palliative care program goes along with the health center, Rafael Health Center, is when a child begins early in life with behaviors, certain sexual behaviors, and you have HIV, and say a young lady has HIV, and then there's multiple partners involved, then you have HPV, and then you have cancer. So it all goes together.
And
so
malnutrition, and the health patterns of eating.
Correct.
And
then
the
you have a
diabetes
mother
later.
that dies and leaves her 3 kids orphaned, and they're malnourished.
it's all
So
part
really,
of
to
it.
me, the whole, people say, what the issue in Africa is HIV epidemic and TB. Actually,
It's just
no.
the result of
It's the result of
life
behavior and life patterns when you don't have the education you need.
Sure. And so how do you deal with palliative care right now on a weekly basis? What's your program? I mean, you need shoes and
Well,
a
right
backpack full of stuff.
Right
and
now, Kashusha, my colleague, and I, we
Kashusha.
divide up the
his
Kashusha,
name?
my YWAM colleague, James Kashusha, we kind of divide up the load. I would say,
So there's 2 of you.
there's 2 of us, and I don't keep track of all my patients I see. I mean, I do a lot of wound care and other things, but patients on the program that we see consistently, if you want numbers, I have numbers.
Yeah, on a weekly basis right now.
2017, I had 4 patients on the program.
So in 2017 you had 4?
4. 2018, I had 12.
12, so it tripled.
2019, I only had 4 because we were gone 6 months.
Oh, that's right.
2020, I had 16.
Okay.
2021, I had 25. 2022, I had 36.
Wow.
The last 3 months, I've signed on 17 patients.
Wow. So we're
Within
close
3
to,
months.
close to 50 a week. And like right before we started this video, there was around 6 or 7 people on the gazebo that ended up being 2 because they waited for Carla while she was inside. And that's our chicken. We're in Mozambique, so our video will probably have chicken noises on it. We apologize for that. I'm going to go clear the chicken while you answer the last question here. What do you need to get, because there's 2 of you operating mobily to carry that load right now. 2 people,
Correct.
1 local and yourself. And then you have also partnered with the local hospital and the one above. No one's really going out with you. But how do you want it to look?
Yeah.
I'm going to get this chicken out of here.
How do I want it to look? I don't want it to be about me. This is funny. I don't want it to be about me. The goal is to, again, empower the community in a they have their own culture. And as you can tell, I'm a foreigner. So empowering the community with their own approach. But really, when people are dying or chronically ill, we all want to be treated with dignity and honor. So for me right now, it's a matter of, I would say, funding, as always, because you need funding to bring in the resource to train people, to train the locals. I don't want to just bring in more foreign missionaries to do what I do. I want to empower the locals to do that. So really funding for that, probably I would say 2 years of solid funding to where we can train the medical physicians and the nurses and others that are interested, and just empower them to take over the program. And that's part of the, you can speak of discipleship, but part of our mission is like we disciple in everything we do. So when I'm out doing palliative care, when I'm, the whole idea of the health center is we're discipling people life on life, how to care for each other, speaking their language, understanding their culture. They're capable. Mozambicans are capable.
And you have, from what I understand, you have a couple of women. We were blessed to have it be a young male, but you have a few women on your radar right now, right?
Yeah. Don't allow it, of course, because another part of the program is palliative care is special needs kids. Children with special needs. We have a high population of children born with cerebral palsy from cerebral malaria, which comes with high fevers and can have brain damage. So again, the focus initially will be the 5 and under special needs children in palliative care.
And how important is it for those ladies
and wound care
to understand the culture themselves? Like, some of the women that would be looked down upon education-wise are actually the ones that speak the language of the people that are suffering the most, like in the village of Palembe, and that have the same cultural background. They're the actual same people group. So actually, the least shall be the greatest, right? The one that is the servant to all will actually become the leader is kind of what you're seeing amongst the Yao right now for your future of picking people, right?
Yeah, very much.
You have to get their identities for them and stuff, though, right?
Well, yeah, because a lot of it's just fear, and then we come in and try to contextualize, or we're afraid to speak honestly. But when people are dying or suffering, we're all human. We all have the same feelings and emotions. And when we're carrying Jesus and bring Jesus into the situation, it's not offensive. So,
And how far is the farthest patient you have dealt with palliative care so far?
well, they actually, it's a little different than when
2
I was
things.
in
How
Manica.
far is the farthest you've dealt with?
Yeah,
And how far is the farthest you've sent someone?
yeah.
So your program already has served people 35 miles away and has been able to catch something that's been needed to be served 200 miles away.
Yes.
From a people group that have never gone more than 5 miles away from their village. Is that correct?
Perfect.
Amazing. Now just chew
Yeah.
on that for a second.